On the topic of stem cells, what conditions would you typically, or would someone want to use a stem cell therapy for?
A lot of the same ones as the PRP. We can divide into soft tissue injuries, tendons or ligaments, and then joints. And so for joints, there's probably a little bit more data. The head-to-head studies where they've included PRP and fat or bone marrow stem cell type products, they don't seem to help with pain or function that much better than PRP. What they offer is that they may offer a longer period of relief before the pain comes back. That being said, there's certain patients where they just do better with the stem cell type products versus the PRP, but we don't really have a great sense of who's going to be a better candidate for one or the other. So it's usually kind of how we will counsel our patients. The downside of the stem cells over PRP is it's a little more invasive to do a mini liposuction procedure or to remove bone marrow aspiration or remove those cells versus just a blood draw for PRP. In addition, the supplies are a lot more expensive. So those procedures tend to be a higher out-of-pocket cost for patients.
So are you taking it from the patient themselves, or are these getting harvested somewhere elsewhere and then injected into this person?
No, they're injected from you. So they're your own cells. So again, it's kind of like a transplant to some degree where you're moving cells from one point to another. And so they're regulated, obviously micronized fat, as a cushioning cell, broadly in orthopedics.